The reason why most people come to our clinic to get treated for fungal infections is that it's an embarrassing condition. They don't like the way their nails look because they're going to be discoloured and disfigured, and they can also sometimes cause pain. These people tend to hide their feet in shoes all day, and all they want to do is get their feet out in public. In most cases, fungal infections is just a cosmetic issue. The only exception is going to be those patients with diabetes. If they do have any type of wounds on their feet, and if you do get a secondary fungal infection, it can be quite serious. There are three main options for treating fungal infections. The first is going to be using topical solutions, which can be quite challenging to apply to the nail every day. It takes time, and at the end of the day, it's really not that effective. Only about 5% of cases will have a positive result. On the opposite end of the spectrum, you're going to get oral medication. It is pretty effective, but it has many side effects and it can be quite harmful to the liver. So you only want to use that in really aggressive cases. The middle option is laser, which we have found to be the most effective. But I must point out that there are two different laser systems on the market for treating fungal infections. The first is hot laser. Practically, you're just using a source of heat to pass over the nail. You're heating up the nail to a certain temperature, which has been proven to kill off most fungal elements. We have used that previously in the past. The issue is we did not find it to be that effective, and it was also quite painful. So it wasn't something we were ready to introduce to patients. What we use at the moment is cold laser therapy. It does not hurt, and it has no side effects, and we have found the success rate to be overwhelmingly more successful than any of the other modalities. Cold laser has been an amazing tool in treating fungal infections. The first point I want to repeat, it does not hurt, which is really great for patients. But effectively how it works, it has two different lasers. The first laser actually targets the cellular walls of the fungus. This in turn sets off an immune response. The second laser actually stimulates blood supply to the area, brings more nutrients, which stimulates the growth of healthy nail, but it also brings more immune bodies to the area, which secondary attacks the fungal elements. One of the most important questions that we get asked all the time is how long will it take before you can see a difference in the nail? Now, within the first month, you're going to see some positive changes in the nail. What we consider positive changes would be the colour of the nail bed. Usually it will appear to be pink. The texture of the nail will change as it becomes a bit stronger. And even in the first month, in some lucky patients, you can actually see some positive healthy nail growing through the back. But realistically, in a normal healthy adult, the nail will grow approximately 1 millimetre a month. So if you're looking for a whole nail to grow out, you're looking at 12 months before that nail is going to grow out. Also take into account, most nails that come in have been stunted, they're badly traumatized, so it will take them much longer to grow out. So typically within the first month you can see positive changes, thereafter anywhere from 3 to 12 months before you start seeing fantastic results. During the process of treating patients with low-level cold laser, you can actually wear nail polish. We tend to discourage it though, because you want to keep the nail open. We don't encourage women to wear nail polish because nail polish actually does damage the nail plate, and that's going to be one of the factors contributing towards their fungal infection. We're not opposed on certain occasions. If you've got a function, definitely put nail polish on, but do not leave it on for more than a couple of days and take it off. We tend to treat a few kids that present with fungal infections. The great thing with cold laser, it's the only laser that's safe to use with kids because there are no side effects and it is pain-free. For those ladies who are pregnant, unfortunately, we are not allowed to use the cold laser on you, and not because it's not safe, it's just that during the trials and research on the product, they are unable to test it on pregnant women. You would hate to have any adverse effects, so unfortunately we cannot use it. Some of our ladies do check with their specialists, and on occasion we do get the go-ahead to use it. It is safe, it just cannot be tested and proven. So the first step in the treatment of your embarrassed fungal nails starts at the initial consultation. Now the purpose of that initial consultation is to come to an accurate diagnosis. Firstly, we want to make sure that it is a fungal infection and that it isn't just a traumatized nail or a systemic condition that has resulted in damage to the nail plate. So we have multiple clinics throughout Sydney. In each of these centres, we have qualified podiatrists that have got a wealth of experience in treating fungal infections. The best way to get an appointment would be to call the clinics directly and find a time that would suit you.